Thank you for joining us for this COVID-19 employment law Q&A session. My name is Carissa Miller. I am the Program and Communication Specialist for Montgomery County Medical Society. I do have a few housekeeping items before we begin. We have muted all participants at the beginning of this call for sound quality purposes. To mute or unmute yourself, press *6 on your phone. On a PC, you can press Alt-A, and on Mac, Shift-Command-A. We do welcome your questions. How we will run the Q&A portion is we will start at the top of the chat box and work our way down, and then we will move over to audio calls at the end. So here's a little bit about this session as we begin. In today's rapidly changing social and legal environment, physicians in particular are facing a number of complicated and difficult decisions about their businesses and in particular their employees. This presentation will begin with a sequence from David Shapiro and Jim Hammerschmidt of the law firm Paley, Rothman, which is based in Bethesda. Jim and David have years of experience working with healthcare practices and physicians and employers in general, and will provide a brief summary and new and existing laws impacting Montgomery County-based employers as we all try to navigate this new world dealing with COVID-19 related laws and business issues. So they'll give a general presentation, then they have a sequence of questions that they've gotten very, very frequently over the last week or so that they'll go over. And then at that point, we'll open it up to the Q&A. So we encourage you to kind of hold your questions until we've made it through the frequently asked questions portion of this. So with that, I will go ahead and hand things over to Jim Hammerschmidt for the first bit of our presentation.
Okay. David, do we have the
Yep, I just,
do we have the PowerPoint up here?
I just need Carissa to give me the screen. All right. All right. Should have our slide deck up. Carissa, can you see it?
I can.
All right. Terrific.
All right. Do you want to go to the next slide, David?
Keep going. All right.
All right. Here we go.
All right.
Thank you. Well, good evening, everyone. Carissa, thank you for the introduction. Like Carissa said, David and I are with Paley Rothman, and we've been over the last probably week handling what seems like 90% of our time handling coronavirus-related issues and helping clients work through them, particularly on the employment front. So we're dealing with a whole litany of new legislation and changes to try to help both businesses and employees deal with this public health crisis. And this slide shows a few of the things that have happened that affect us as employers in the DMV, in the District, Maryland, Virginia area. The first piece of legislation that impacts us that we'll be talking about is the federal Families First Corona Response Act that was passed by the federal government last week. The federal government is also in the process of trying to pass additional aid and relief in what they call the CARES Act, the Federal Coronavirus Aid, Relief, and Economic Security Act. Maryland has passed a Public Health Emergency Protection Act, and just today, we'll be talking about this later, it's not even listed on the screen because it happened this afternoon, Governor Hogan passed additional public orders regarding the closure of non-essential businesses throughout the state of Maryland. DC has also passed a COVID-19 Response Emergency Amendment Act, and then all three jurisdictions have changed some unemployment legislation in order to make it easier for employees to get unemployment insurance if they've been either laid off, furloughed, or their hours and pay have been substantially reduced. So why don't we start with the Families First Act here. This was, as I said, passed last week, and it doesn't go into effect until April 2nd, which has certainly some impact on how we as businesses are going to plan any leave, furloughs, layoffs, etc. The first act is the Emergency Family and Medical Leave Expansion Act. And then there's the new federal paid sick leave law. Both of these provide a certain level of leave protection and paid leave for employees. The first one is an amendment to the Family Medical Leave Act. And for any employers that have 50 or more employees in a 75-mile radius, you're probably somewhat familiar, if not very familiar, with the Family and Medical Leave Act. It provides for unpaid leave for up to 12 weeks for any employees that have worked 1,250 or more hours in the last 12 months. And as I said, it applies to employers with 50 or more employees in a 75-mile radius. And it provides leave for various serious health conditions of the employee or the employee's immediate family member. Well, the federal government has modified that leave law. It is now applicable to all employers with 500 or fewer employees. Employees do not have to be employed for 1,250 hours. They only have to be employed for 30 days. And it adds another reason that employee can take leave under the law. And in this case, if an employee has to take leave because their school-age children are no longer in school, the schools have shut down, or the daycare is shut down, the employee is entitled to 12 weeks of leave. And rather than it being unpaid, as with the regular family medical leave, this will actually be paid for the final 10 weeks. The first 10 days are unpaid, but we'll see where the employee can get that back. Then the final 10 weeks are paid at the employee's, at 2/3 of the employee's regular rate of pay. There are caps up to $200 per day per employee and $10,000 aggregate per employee. So this is a very, very narrow opportunity for an employee to get some unpaid leave if they have to stay home and they cannot work or they cannot telework because they have to care for their child. There is going to be an exemption, possibly, for employers with fewer than 50 employees if providing the family medical leave jeopardizes the viability of the business as a going concern. We don't know yet what that framework's going to look like, what an employer is going to have to do to prove that providing that leave is going to impact the viability of the business. That is to be fleshed out in some Department of Labor regulations that we're expecting to see probably this week. Additionally, under the FMLA, an employee is normally entitled to be reinstated to the same job or an equivalent position when they return to work. But here again, there's going to be a slight wrinkle in this new Emergency Family Medical Leave Act that says that reinstatement, that there's an exception for employers with fewer than 25 employees if the position no longer exists due to economic conditions or operational changes that are made because of the public health emergency. Again, I think there's going to be more that's going to be fleshed out in that when the regulations are issued, but for right now, that's the extent of what we know as set forth in the text of the legislation.
Thanks.
So that's the new Emergency Family Medical Leave Expansion Act. The next piece of legislation that may give some relief to employees who need to take a leave of absence is called the Paid Sick Leave Law. And I'm going to start a little bit, if you look at the slide, I'm actually going to start from the bottom. Here, an employee is entitled to 80 hours of paid sick leave for certain issues related to COVID-19. And if you look at the bottom one says care for a child whose school or childcare has been closed. So here's where you get, if you go back to the family medical leave, recall that the first 10 days are unpaid. But here, the first 10 days are paid. So at that same 2/3 regular rate. So in effect, what happens is Someone who takes leave because their child's school or daycare has closed is actually going to be able to get a full 12 weeks of paid leave at 2/3 of the regular rate by combining both the paid sick leave law and the Emergency Family Medical Leave Expansion Act. They will be covered for the full 12 weeks. The 10 days of paid leave under this paid sick leave law is also available for employees who self-quarantine on the advice of a healthcare provider, if the employee is diagnosed with COVID-19, if they are ordered to stay home or stay away from work due to their own exposure or symptoms of having been exposed to or contagious with COVID-19, or they care for a family member who is self-isolating or has COVID-19. And as you see, for the first three categories, that is where the person has their own diagnosis, they've caught the virus themselves, or they have to stay away from work, the 10 days is paid at their full regular rate. If they're taking care of a family member or a child, it's paid at 2/3 of the regular rate. And then there is caps on all of this. So for employees paid at the full regular rate, when they're either taking care of themselves because they've come down with the virus or have been exposed, there's a cap of $511 per day per employee and $5,110 per employee total. And then that cap is reduced to $200 per day per employee, or $2,000 overall if they're taking care of a family member or a child. Here again, the paid sick leave law may allow some relief for a business if paying for the paid sick leave jeopardizes the viability of the business as a going concern. And here again, there's notice requirements. The employer can require the worker to follow reasonable notice procedures to continue receiving the benefits after the first workday that the employee receives the paid sick time under the Act. By and large, the CDC and other agencies are begging businesses not to require employees to receive or obtain a doctor's note if they're going to be sick. But as David will talk about later, and as you all know, there's a big movement toward telemedicine. So requiring someone to get a doctor's note may not be as big as an imposition as it seems to be now. But we'll see how that goes. But the law does not necessarily relieve the employee of that requirement, but certainly the CDC and other agencies are encouraging employers not to go the route of making employees obtain a doctor's note if they have symptoms or they've come down with the virus.
Okay, so the federal legislation doesn't cover all employees. There is a healthcare worker exclusion where the Secretary of Labor can exclude healthcare providers from being able to participate under the regulations. And the definition of employers who are allowed to take leave is clarified or set forth by the Secretary of Labor. The question that we're getting a lot here, and it's jumping forward a little bit, is whether or not our typical medical practices in Montgomery County are supposed to be working, whether they're by the governor's edict today that all non-essential businesses should close. And ultimately, healthcare practitioners, and we'll get back into this a little bit towards the end. I actually think it's just coming out today. Medical practices are deemed essential. Whether or not you guys decide to stay open is a different thing. We can talk about that a little bit more at the end. In addition to that, while they're not specifically excluded, under the new federal regulations, what's not covered are employees who refuse to work because they're afraid of exposure. Employees who are out of work, but they're not out of work for one of the qualified reasons set forth above. That's people who have either been exposed or are sick or are caring for a family member who's sick, or people who are out of work before April 2nd. That's an important issue, and again, we're going to revisit that date later on in the slides. Jim?
Yeah, so the $64,000 question that most clients have is how the heck are we going to pay for this federally mandated leave? And the structure that has been set up under the Families First Act here is that an employer is able to recoup a dollar for dollar credit against the payroll taxes that they would normally have to deposit on a quarterly basis. So what happens is you need to keep track of any amounts that you're paying to employees for leave under either one of these two new statutes. You want to track that very, very closely. And then when it comes time to deposit the quarterly payroll taxes and submit Form 941, what you'll be able to do is take an immediate dollar for dollar credit against any amounts that are owed on that quarterly basis. So just by way of example, if your payroll taxes, including Social Security, David, if you can go to the next slide, please. Including Social Security, Medicare taxes, federal income taxes, etc. Let's say they amount to $8,000 on a quarterly basis, and you've paid out $5,000 in paid sick leave or expanded family medical leave. You will essentially get to retain that amount as an immediate credit from your quarterly return. So in a sense, it is immediate money in the pocket of the employer to the extent the employers had to pay any of that out. And if, David, you go to the next slide, we've put together sort of a step-by-step way of doing this. So first, obviously calculate the payroll tax liability, then calculate the aggregate amount of qualified sick leave wages and qualified family leave wages to be paid to the covered employees. Calculate the maximum credit allowed for wages paid to all covered employees. And then calculate the amount of qualified health plan expenses, because those are also part of the package that you get to include for the employees who are on leave. And then that sum is deducted from the amount that's required to be paid by the employer in the quarterly payroll tax deposit. It's in a way, it is money in your pocket. You can figure out how much that is going to be. Most businesses can, with some reasonable degree of accuracy, anticipate what their quarterly payroll tax liability is or is going to be. And then you'll know when you're providing that leave how much of that is that you're not going to have to pay, and that will be able to remain in your operating funds. Likewise, if take the hypothetical and flip it around, if the payroll tax liability is typically around $5,000 and you've given $8,000 in paid leave to employees under the Act, then you'll get an immediate rebate of that amount. So you'll get to keep the full $5,000 plus the federal government will give you the $3,000 on top of that. So you get the 100% credit, whether it is less than or greater than your quarterly tax liability.
So one of the challenges that a lot of employers are facing right now is trying to figure out what to do. The expectation is that the Federal Coronavirus Aid, Relief, and Economic Security Act, the CARES Act, is going to be finalized this week. We're not exactly sure what it's going to look like, but the idea behind this is that this is intended to provide relief, and it's actually intended to serve as an incentive for employers to keep their employees on their payroll. In the drafts that we've seen, what we're expecting is that employers would be able to delay payment of their payroll taxes for at least a year or two. It's not clear exactly if it's going to be in the same model as what we've seen in the other federal laws, but again, that's the idea, is to keep money in the employer's pocket. The other piece of it is setting up loan programs that are intended to allow employers to keep their employees getting paychecks. And again, the idea would be that they'd like to provide at least 8 weeks of cash flow assistance through these guaranteed loans. If the employer maintains their payroll, a portion of the loans may in fact be forgiven. So in addition to that, there's been a significant amount of changes, and Jim will talk about these a little bit in more detail below, to unemployment benefits, certainly in Maryland, DC, Virginia, but we're seeing them across the board. And we think that this is going to be something that a lot of employers are going to be relying on. But again, Jim will give a little bit more detail about unemployment in a moment. As many of you know, last week, Maryland put in place Maryland's COVID-19 Public Health Emergency Protection Act. This is significant for healthcare providers in particular, because it does waive a lot of telehealth protocols that you all are familiar with. The biggest one, which is an obstacle for a lot of people in this area because of our proximity to DC and Virginia, is the requirement that providers be licensed in the state where they are consulting with the individual on the other end of the phone or the other end of the video link. Maryland has waived the requirement that providers be licensed in Maryland for purposes of providing telehealth at this point in time. In addition, for those of you who have licensure coming up, any of those kinds of things, Maryland has extended your requirements, your timelines for completing your reapplication process. In addition, the Maryland Act prohibits employers from terminating employees solely because they've been isolated or quarantined. And then finally, it allows the Secretary of Labor to allow workers who haven't been terminated to start to collect unemployment insurance if the employer has been closed due to COVID-19. Again, Jim will touch a little bit more on this below. So one of the things, we're going to, there's some information here, we'll show you. There's some information here on DC's law, and there's some information on Virginia law in the deck. We're going to focus on Maryland issues, but we did want to leave those slides in the deck so you could reference them. If there are specific questions about DC, most of my day-to-day was spent dealing with DC related issues. But if there are specific questions, you can certainly reach out to us or check with your counsel on DC or Virginia specific issues. All right, Jim.
Yeah. So as David mentioned, there's been changes to the unemployment requirements. And by and large, these kind of, the Maryland, DC, and Virginia all kind of are in line with their changes. Normally, obviously, as we know, an employee cannot get unemployment unless their employment's been terminated. That requirement has been relaxed under the various COVID-19 emergency legislation, and now in the state of Maryland, the Maryland Secretary of Labor can determine that someone is eligible for unemployment even if they haven't been terminated, if the employer has ceased operation because of COVID-19, if the employee has been quarantined as a result of COVID-19, or if the employee has ceased work because of risk of exposure or infection, or to care for an infected family member. So again, if you go back to some of these statutes, and employees who are, say, they're furloughed or they have reduced hours, they will be able to apply for unemployment and be able to get hopefully some supplemental help from the Departments of Unemployment. And if this CARES Act ever makes it through Congress, hopefully the unemployment offices will be able to get some federal assistance there as well. Most of the jurisdictions, including the Maryland Department of Labor, has put out very helpful question and answer sheets on their websites, and I would encourage you to direct any employees that have questions about how a layoff or a reduction in hours may impact their ability to get unemployment compensation. Direct them to those resources. I've looked at them, and they are very helpful Q&As. The one from Maryland makes clear that employees who have not been terminated but who are unable to work because their employer has temporarily ceased operations due to the virus may be eligible for employment benefits, and employees whose hours have been reduced because of business slowdown may also be eligible for partial unemployment benefits. Normally, if a worker files for unemployment, they have to certify every week that they are continuing to seek work. Maryland, as far as we know, has not relaxed that requirement. DC and Virginia have, in fact, relaxed that requirement. I don't really foresee that being a sticking point if someone otherwise qualifies, even in Maryland. I think there's gonna be some flexibility, and I wouldn't be surprised if we see that disappear here shortly as well. So, David, if you can go a couple slides down. So the next one's DC. Yeah, okay, before that, I'm sorry, go back up, David.
Yep.
Something you may want to consider, and this is a program that the Maryland Department of Unemployment has that is not very well known and has been little used out there in the business community, but certainly is something that is worth paying attention to right now. And it's called a work sharing program. It's a voluntary program that provides an alternative to layoffs for employers faced with a temporary decline in business due to lower economic activity. Not something we've generally seen in the last 13 or 14 years. What it allows an employer to do is retain an entire group of employees by reducing the group's hours of work by a percentage equal to the total reduction of hours that would have been achieved by a layoff. In other words, if you do a pro rata reduction across an entire subset of employee group, then you can qualify for this work sharing program. And what happens is the employees, even though they haven't been laid off and even though they haven't been out of work, but because their work schedules have been reduced and their pay has been reduced, they can get an offset from the Maryland Unemployment Insurance Commission. So it's a bit like the changes to the uninsurance that we were just talking about. But in this case, what you would do is allow an entire group to take advantage of that by doing a pro rata reduction in hours. And it's a program, there's a link. Again, if you go to the Maryland Department of Labor and put in work sharing program, you'll find a link, and you may find that to be a worthwhile program to look into as well. It's an option. So I think, Dave, the next two slides are DC and Virginia, which I said have basically made the same kind of changes to the unemployment legislation or the unemployment requirements that Maryland has. If you go to the bottom line here for unemployment, these are questions that we were getting from our clients so that they could then respond to their employees. And yes, an employee may be able to get unemployment benefits if they can't work because their employer has temporarily ceased to operate during the virus. In other words, their employment hasn't been terminated. Maybe they've been furloughed. They've just been put on unpaid leave. The employer hasn't terminated employment. It's just temporarily ceased operations. Yes, an employee may be able to get partial unemployment if their hours are reduced because of the virus. And again, so far, Maryland has not let up on the certification requirement. DC and Virginia have. So that's information that maybe doesn't as much directly impact you, but it's information that certainly on top of mind for your workers.
So that's a sort of a summary of where things are today. We assume that the law is going to continue to evolve, and we may need to come back to you with even further updates. What we want to do, as Carissa noted at the beginning, is over the past week to 10 days, we've been receiving a number of questions across the board. I wanted to go through with you sort of the most asked questions, try to give you some answers on those. And then at the end, we should be able to open it up to questions that have been asked either through email or through chat. Carissa can manage that for us at the end. And then if there's time at the end, we can open the line as well and ask questions that are still remaining. All right, Jim.
So, figuring out how all of these leave laws fit together is a bit tricky. And in Montgomery County, it's even trickier because in Montgomery County, as many of you may know, we have the Earned Sick and Safe Leave law to contend with. The Earned Sick and Safe Leave law says that full-time, part-time seasonal employees can get 1 hour of sick and safe leave for every 30 hours worked, up to 56 hours per year. Now, for very small employers with 5 or fewer employees, it is 32 hours of paid leave and 24 hours of unpaid leave. So you have this bucket that your employees are entitled to take for paid leave in Montgomery County. And one of the reasons that an employee is entitled to take this leave in Montgomery County is when an employer is closed and not operating because of a public health emergency. So if your practice shuts down or ceases operations and an employee is put on leave, they may elect to take their accrued earned sick and safe leave that is required to be provided to them by Montgomery County law. And so that's sort of a first bucket that the employees can go to you as an employer and say, I've been put on furlough, the business is closed because of the coronavirus, I have 56 hours of paid sick leave accrued on my leave sheet, I'm going to elect to take that and you need to pay it to me. Under the Montgomery County statute, employers can provide that leave in one of two ways. They can provide all of it up front at the beginning of a leave year. So some employers choose to provide the 56 hours up front because then they don't have to roll it over on the back end. Or, and I think this is what most folks do, is just accrue it as part of their regular PTO, policy. If it's provided on an accrual basis, then employees can roll over any unused earned sick and safe leave, and they can use up to 80 hours per year. So some of your employees may have rolled some of that over and actually have more than 56 to use. They may have up to 80 hours of earned sick and safe leave to use. So that is available to them. And so, for example, if an employee is eligible for the expanded federal family medical leave, but that doesn't kick in until, because the first 2 weeks are unpaid, it doesn't kick in until that 2-week period is passed, the employees may be able to use this Montgomery County earned sick and safe leave as a supplement. Likewise, the federal statutes say that the leave provided under these two new federal laws is in addition to any other leave provided by the employer. So there is, I think, at least a question, and I believe the answer would be that if an employee has earned sick and safe leave, they could wait to use that on the back end of any of the federal leave that they're entitled to take. So you just have to realize that there's, at least in Montgomery County, there's this separate bucket of leave that the employee may have at his or her disposal to use in addition to the leave that is permitted by the two new federal statutes.
Thanks, Jim. So related to that is, what if the employee has other types of leave, either general leave time or other leave that the practice has provided? A question that we're getting a lot is, can we furlough people or can we tell people not to come to work and just require them to take their paid time off. So this is one of those things that has changed over the last week with the federal legislation coming out. And the simple answer is no, that you cannot require your employees to use their other leave first. So as Jim was saying, if there is other leave available, your employees may have the option of using that during the first 2 weeks while their new federal FMLA expansion benefits are kicking in. But if they also are at home or self-isolating, then they may be entitled to be paid under the new sick and safe leave component. So it's, as Jim noted, this is something that you really have to look at as a planning piece for you in terms of trying to decide your timing and what you're doing with employees. So for example, one of the best practice that we've come up with is for employees that are missing work due to childcare issues. They may be allowed to use 80 hours of paid sick and safe leave during the first 2 weeks of what would otherwise be the unpaid expansion of the FMLA benefit, which would be at 2/3. And then an employer may allow them to also supplement. What we mean by this is if you have an employee that's out and is getting paid at a reduced rate, you may actually allow them to use a portion of their PTO during that time period, so they're actually getting paid at a full-time equivalent.
I think go ahead, David.
Go ahead, Jim.
No, as you say, it's important to note, though, that this all doesn't kick in until April 2nd. So as David said, planning is really important. The question is that we're getting from a lot of practices, what do we do now? We know what our rights and responsibilities are going to be come April 2nd. And a fair number of practices that we've dealt with and talked to are taking this whole the coronavirus issue sort of in 2-week increments. So they've said, okay, we're going to go ahead and pay our employees for this first 2 weeks and then see what happens. If you do that, which is fine, and it's treating your employees well, and it may be a fair way to do it, but keep in mind, if you don't have them use their PTO now, so you just pay them and allow them to keep the PTO for use later. Let's say someone has 100 hours of PTO, and from now till April 2nd, or over the last couple of weeks, you don't require them to use it, you allow them to keep it in the bank. That PTO will then, as David said, become something that they can use in addition to the emergency family medical leave or the paid sick leave after April 2nd. So the thing that I see clients struggling with is, as a matter of fairness and equity, do I force my employees to use their PTO now, or do I allow them to keep it in the bank? If I allow them to keep it in the bank, it may end up costing me more later because they will then have it to use on the back end of any of this other federally mandated leave. So it's certainly something to think about and question, and I think it's something that each individual practice makes its own decision about based on its own ideas of equity and how to treat the employees and what to do, but you should certainly plan for it. And you may have to look at maybe putting in some different policies and practices. Some employees may not have a lot of accrued leave to use right now, and forcing them to use it could put them in a very difficult position. On the other hand, there may be some long-term, long-tenured employees that have quite a healthy bank of accrued and unused leave, and maybe it's appropriate for them to use some of it now between now and May 2nd, and if they need to use it later, they'll still have plenty to tide them over. So it's, you got to look at your own accrued but unpaid leave situations, look at your workforce, and make some independent decisions about how you would like to do it.
So as Jim noted, this is a planning issue because the federal benefits go into effect as of April 2nd. So that means that you're in a little bit of an unknown period right now. So for example, if your office is open, but you have furloughed employees as of April 2nd, for those furloughed employees, these federal benefits would kick in come April 2nd. Now, if you're closed as of April 2nd, the new federal leave benefits wouldn't apply, but you still, keep in mind, you still would be obligated to comply with the Montgomery County and DC sick and safe or earned leave laws. So that's why we are really encouraging all of our clients to go revisit what your policies and plans are so you can start laying out a framework for what's going to work for your practice.
And another piece of the puzzle that unfortunately we don't have at this exact moment is that there are provisions in the CARES Act that's currently pending in Congress that may provide for either loan relief or maybe even loans that may be forgiven for employers that continue to either employ or pay their employees backdating to March 1st. So allowing an employee to use PTO, for example, is not something that's coming that would be covered by the CARES Act. But if you go ahead and pay the employee during this period of time, that may be something you can get back from the federal government. So we got to watch the CARES Act closely, and when it passes, build whatever provisions that are in that act into the planning process as well, because it may actually be beneficial to, if you can, continue to pay the employees rather than forcing them to use leave.
All right.
Okay, so one of the distinctions that is often required to be dealt with in situations like we're experiencing here is the difference between exempt and non-exempt workers. So I don't want to get into a long discussion of the Fair Labor Standards Act and all about exempt and non-exempt, because that's a whole day long seminar in and of itself. But suffice it to say that your exempt employees are employees that meet two criteria. They're paid a salary regardless of the quality or quantity of work they perform, and the type of work that they do fits in the white collar exemptions, that is administrative, professional, or executive employees. And exempt employees, as we know, do not have to be paid for overtime. So they can work 50, 60, 70, 8 hours a week, and they just continue to draw the same salary. One of the questions that we're facing from clients is, can we reduce the salaries for exempt workers without running afoul of the Fair Labor Standards Act? And the answer is yes. Under the circumstances that we have, most businesses should feel comfortable reducing salaries, if that's what they want to do, of exempt employees. Under normal circumstances, an employer cannot move a salary up and down, stay week to week, payroll to payroll, month to month, because essentially then it looks to the Department of Labor like you're really paying the employee for the quality or quantity of work. You're not paying them an actual salary. So the Department of Labor frowns on frequent changes to salaries of exempt workers. But certainly in this circumstance, a one-time cut that affects all employees, or even a cut now and maybe another cut later, is not going to cause you to run afoul of the Fair Labor Standards Act. Just keep in mind that the salary threshold for exempt employees as of January 1 of this year is approximately $36,000 a year. So you do not want to lower an exempt worker salary below that level, because that will trigger a loss of that worker's exempt status. Okay, the next question, I think I've got this one too, David, is yep. Can my non-exempt employees receive unemployment insurance if they're transitioned from full to part-time work? I think we covered that earlier with the new changes to the various unemployment insurance requirements in the DMV, the answer to that is going to be yes. Okay, salaries, exempt employees during closures. Even if furloughed, exempt employees must receive salaries if they do not work or use PTO. So here we're getting back to these slides are probably out of order. We got to change that next time, David. Here we're getting back to another question about exempt employees. Exempt employees have to be paid in any work week in which they perform any work. So if you have a salaried exempt employee and that employee works on Monday, they're entitled to be paid for that entire week. Now, if they have PTO, you can use the PTO for the other 4 days to supplement the income. But for example, if you had an exempt employee that was out of PTO and that employee only worked on Monday and called and said, I'm not going to work Tuesday, Wednesday, Thursday, I'm going to do whatever it is and I'm just not going to work. Unfortunately, in order to maintain that exempt status, an employer has to pay that employee for that entire week. A salary can be eliminated by doing furloughs as long as no work is performed during a work week. So if you are going to furlough your exempt employees, you have to be very certain that the employees stay off the internet, stay off text, don't respond to clients, don't respond to vendors, don't respond to managers and supervisors. They need to perform no work. If they perform no work, you can eliminate the salary for that work week for an exempt employee without running afoul of the Fair Labor Standards Act. The unique little caveat in Maryland is that the Maryland Wage Payment Collection Law requires 2 weeks notice for a change in pay to an employee. So you need to be thinking a little bit ahead. I mean, if you 2 weeks can be just a massive amount of time under the current circumstances and business climate. Anything can happen in 2 weeks. So if you're at all considering reducing salaries for exempt employees, or for any employees for that matter, the sooner you come to that conclusion and realization, the sooner you can give the notice, the better. So for non-exempt employees, typically what we call our hourly employees, are much easier to deal with. They're only paid for the amount of hours they work, and you can eliminate their hours, change their schedules, reduce their pay. If you're going to reduce their hourly rate, say you're going to bring them down from $30 an hour to $20 an hour, that would trigger the 2-week notice requirement under the Wage Payment and Collection Act. So again, planning to do those things, the sooner the better.
So one of the questions, and we touched on this earlier with respect to what Maryland has done, but the federal government has also provided a lot of guidance over the last week about telehealth. And this applies not only to patient encounters with providers, but also to lab work and how these items can be reimbursed. So CMS generally has the ability to provide waivers. They've relaxed those waiver requirements even further. For those of you who participate in federal payment programs, you'll know that waivers generally come into effect where the government is willing to reimburse providers for services provided during a critical time, even if the provider does not meet all of the requirements for reimbursement. So under the changes that have taken place on a federal level, Medicare generally will pay for telehealth visits, and there's been also a relaxation of the in-state, out-of-state requirements that you'll see. So if you have a large Medicare base, it's worthwhile to speak with your billing folks about the updated CPT codes or federal payment codes that are being used to make sure that you are getting reimbursed for your visits at full rate. Let me see where we are, Jim. So we've been getting some questions from providers about what they should be doing in office. This generally boils down to practicality, although there is some additional guidance from Maryland. I think MedChi has helped to publish some of that. Generally speaking, OSHA requires that measures be taken to protect staff from dangerous conditions. What we're finding most providers are doing is trying, where possible, to move all encounters with patients that may or may not be affected into telehealth if possible. Obviously, that's not always possible. We're seeing a move towards moving non-urgent care, something like general follow-up visits, annual visits. Most of those we're finding are being postponed. So it's really a matter of trying to make sure that you're available for your patients where necessary, but trying not to increase the risk of exposure in the office. What we're generally finding for our general practice practitioners, they're screening people on the phone before they set appointments. If people are coming in because they have concerns related to COVID-19, they're generally triaging those ahead of time. They're usually having people call from their car when they're there for their visit. They're trying to not have them come through waiting rooms if there's another alternative. So it's really a matter of putting in place measures that try to limit exposure as much as possible. If there is exposure, then certainly the CDC has a number of very clear guidelines on what should be done. So it's something to be mindful of as you move forward. So there's a question about whether employees can refuse to work. This is related to the previous slide. Generally speaking, an employee is only entitled to refuse to work if they believe that they are in imminent danger, which generally means that they're in danger of death or serious physical harm. At the moment, most work conditions in the U.S. are not deemed to be putting workers in imminent danger. Obviously, there are certain circumstances where that may be different, but hospital workers generally are not being treated the same as general rank and file workers. But generally speaking, an employee cannot refuse to go to work because of a fear of the virus. We are finding that there's a middle ground. Some employers that are trying to bridge the gap a little bit, at least for these first few weeks while everybody's getting accustomed to what's going on. And we do have some clients that are allowing employees to use paid leave if they have it available to them. But generally speaking, our employees are expected to work. So the last prepared slide that we have before we open up to your questions is whether your practice is an essential business. The general answer to that is yes, and that does not mean that you are obligated to stay open. Where this definition of an essential business comes in, really tracks the order that was provided by Governor Hogan's office today, where he demanded that all non-essential offices close. Ultimately, the guidance that came out, and we can certainly provide you a copy either of the order or of the interpretation of the guidance that came out. But generally speaking, you're not required to close if you're a healthcare provider. This is generally going to include physicians, dentists, physical therapists, occupational therapists, people in the behavioral health professions, and diagnostic facilities, which would include imaging centers and labs. So the general answer is you are an essential business. Whether or not you stay open is going to obviously be based on a number of other factors. All right, Carissa, we'll turn it over to you.
All right, great. So I'm going to go ahead and start us at the top of this series of chat questions. The first question we have is, if you have employees who have already been out due to possible exposures to COVID-19, can they request that EFMLEA be applied retroactively? Or does it have to, or is it from April 2nd on?
Well, first of all, certainly if someone has contracted the virus, that is going to be a serious illness that would be covered. Well, let's back up. If the business is large enough that it is covered by the Family Medical Leave Act, in other words, if it has 50 more employees in a 75-mile radius, then an employee who comes down with the virus itself certainly has a serious health condition that's covered by the FMLA, and therefore that individual would be allowed, or should be allowed already, to be on unpaid leave of absence under the FMLA, or to be on that leave of absence and supplement any accrued but unpaid or unused PTO for any of that unpaid time. What we don't know is, and the U.S. Chamber of Commerce just sent a letter today, this afternoon, to the Department of Labor with a series of about 20 or 30 questions that are unanswered under this new legislation. And this question that you pose is basically one of the unanswered questions. If an individual is on FMLA or has taken FMLA and the total time of FMLA is 12 weeks, does that time that they've already used get taken off of what they may be able to use to get paid after April 2nd? We don't know. That's something that the Department of Labor is going to have to answer for us. We don't know whether that the new 12-week of paid leave under the expanded family medical leave is going to be in addition to any other family medical leave that an employee has taken over the last 12 months, or will be taking on a go-forward basis. We don't know the answer to that. I think hopefully the 12 weeks will be just as it's always been in the past. You have 12 weeks of the FMLA, whether you've used that before April 2nd, you've used any part of that, it will be taken off from what you can use after April 2nd, but we don't know.
And the one thing I would add to that is, in terms of retroactivity, the general answer as we understand it now is that the new federal laws are not retroactive.
Correct.
The question is the way that the law was technically written. So Jim and I are operating on what seems to be the best interpretation, which is that this is going into effect on April 2nd. That being said, the statute itself actually says that it shall go into effect not later than April 2nd. It is possible that we are going to see some either regulation coming out, or that there'll be something that's changed in the CARE Act. We're not exactly sure what we're going to find out. It is possible that the actual effective date could be something other than April 2nd, not later than it. But what everybody is working on the understanding of right now is that April 2nd is when this goes into effect.
So the direct answer question is no, it's not. For exposures, it's not retroactive. And there would not be any interplay with the law that we're going to see in the next week or so.
Correct.
Okay, so the next question asks, is the 80 hours for COVID-19 sick pay in addition to their usual allowed sick pay?
So the simple answer is yes. These benefits can stack. I think Jim just gave a good example of that, is that these are going to be in addition.
Okay, and this question
going back to my planning discussion a while ago, that is why I think it's important for practices to plan for employees that may have very large accrued sick leave banks, because you could get in a position where if you're giving some leave now but not forcing employees to use PTO, come April 2nd, they could take the federally mandated leave and then tack onto it any additional leave they have.
Our next question dovetails with questions about whether certain benefits could stack. For healthcare workers, would traditional FMLA, STD, et cetera, continue to apply in addition to these new legislative actions?
And we believe that the answer is yes. I think that the question is asking, would employees still be entitled to other benefits to which they're either entitled to by law or by the employer's policies and procedures? And our understanding is yes, those things would still be available in addition to the federal benefits.
Okay. Our next question asks, if an employee has been diagnosed with COVID-19, can they receive short-term disability? Will they also be eligible for emergency sick leave and extended family medical leave? And if an employee has flu-like or URI symptoms, should they be applying for workers' compensation? Will they also be eligible for emergency sick leave and extended family medical leave?
Well, that's a lot.
It's a lot.
It's a lot of questions. Let's take the ones I can remember in there. Workers' compensation, like that's only going to apply if someone's injured on the job.
Right.
If they can show that they contracted it as a result of being exposed in the workplace, and I'm not exactly sure how you show that you may contract it in the workplace as opposed to being out in the community. But I guess if one could show that that workplace injury the sickness resulted of something contracted at work, you may be able to make a workers' comp case, but I think it's going to be a little tough.
And with respect to short-term disability, I think that whether or not this type of illness is covered under a short-term disability plan is going to be subject to the terms of that plan.
Right. I mean, there could be waiting periods, and someone could be sick and recovered before the waiting period is even up.
I think that's right.
All right, we've got somebody asking what constitutes, quote, ceasing operation, unquote.
Yeah, good question. I don't think we exactly know, but look, I mean, if it's a practice and you no longer seen patients and the majority of the staff has been furloughed or put on unpaid leave, I think that qualifies as ceasing operations.
So we did have this issue come up with an employer recently where the providers in the office generally have the ability to see a number of their patients via telehealth, and they think that they can generally see a good number, not all of their patients, without their general day-to-day assistance. They're not looking forward to that because that means they don't have people doing triage, and they don't have people greeting, and they don't have people helping with billing. And one of the things that we feel is important in terms of the planning component as to what you're going to do is you get into a little bit of a gray area if you furlough all of your employees or say that we're not working, we're going to close, but the providers are still working. There's a question as to whether that's really closed or not. So if that's something that you're looking at, we haven't seen any guidance on what ceasing operation is. Our feeling is that obviously if you're closed and you're not seeing patients, then you've ceased operations. But if you're in some hybrid mode where the providers are providing telehealth and they're billing, but none of the other employees are working, we're not clear if that's deemed to be ceasing operations or not.
We have another definitions question here. These changes regarding unemployment benefits say may qualify, may be eligible. What is the may if these are full-time employees whose hours need to be reduced because the office hours are reduced?
Mm-hmm. Well, I guess we say may because there are other eligibility criteria to qualify for unemployment insurance. For example, if someone's hours were reduced or they were um, terminated because they were involved in some kind of misconduct or something like that, that may either partially or completely disqualify them from obtaining unemployment insurance. And also, again, these regulations, if you go back and look, what Governor Hogan has done, what the others have done, is empower the Secretary of Labor to take these steps. So we believe that this is what's being implemented, but there's still a step or two to go before these things become final with the Maryland Department of Labor, as well as the Department of Employment in DC and Virginia. So these things are in the works. I think that they will be pushed through, particularly if the federal government comes through and decides to support the state unemployment agencies and provide them money to implement these things.
All right. The next question asks, do the employer's payroll taxes count in the FFCRA tax credit total in a business with 7 employees?
I assume that what's being asked is, when they ask if the employer's payroll taxes, I assume this means if in this instance, that the employer is the owner and their compensation is being factored into the payroll tax. And I think that the answer is that if the employer is paying him or herself under one of these qualifying benefit plans, under the federal benefit plans, then arguably that could be included. But remember that it's not all payroll, it's payroll that's being paid under the expanded federal federal leave benefits.
Well, it's all payroll. So if you have 10 employees and you're paying in on a quarterly basis based on those 10 employees, and only 3 of them, so let's say your payroll taxes are $5,000 per quarter for those 10 employees. If only 3 employees are accessing the federal leave benefits, and let's say the total to those 3 employees is $2,000, it's still a $2,000 retention against that total $10,000 amount. So the retention is against the payroll taxes for all employees, only even though only a few of them may be accessing the benefits.
Okay. Our next question asks, if we're paying them now and not them, I assume, as employees. So if we're paying employees currently and not making them use PTO, can the practice require that they not use their PTO until the 3rd or 4th quarter?
Yeah, generally a company, firm, practice has the ability to deny the use of PTO by an employee. So the short answer to that is yes. Typically that happens because the employee wants to use PTO at the same time that everyone else in the department or the unit is taking PTO, and you have to have somebody there to man the shop. And so you say, no, you can't use your PTO because 3 people have requested that week before you. So in that sense, an employer always has the ability to deny an employee's use of PTO. Whether or not you would actually want to do that in this case is a whole different issue, because denying the use of an employee's ability to use PTO may prevent them from making rent, paying utilities, that kind of thing. So I think it's a different calculus, but the short answer is whether or not an employee can use PTO is up to the employer. Now, the caveat to that is if you have an employee who quits, or you end up terminating the employee, if your policy provides that employees whose employment has been terminated are entitled to be paid all of their accrued but unused PTO, you're going to have no choice but to pay it out. And at least in Maryland, that is left up to the employer and the employer's written policy. If the employer does not have a written policy addressing what happens to accrued but unused PTO at the time of termination of employment, then the law defaults to paying that accrued benefit over to the employee upon termination of employment. So if you have a policy, and it's a user-to-loser policy, or a policy that the company does not pay out at time of termination, that's fine as long as it's in writing to be given to the employee. But if it says that we pay it out upon termination of employment, then that may be a situation where you're forced to pay out the PTO. Otherwise, while the employee is currently employed, no, you can deny them the right to use it.
All right, so our next question asks for guidance and insights regarding the healthcare workers returning to work after confirmed or presumed infection with COVID-19. I believe that the CDC does have a dedicated webpage under their COVID-19
Yeah.
provider-specific section. Is there anything we wanted to add to that?
No, and David, you may have something. In general, I'm directing clients, practices, everyone to the CDC for that guidance. There's nothing more that we would do differently or suggest differently, certainly.
Okay, so our next question asks, the 10 days of PTO that practices are required to pay after April the 2nd due to childcare, does it have to be the full pay that the employee would normally draw?
No, it's at 2/3 of their regular rate.
Okay.
And we don't know exactly. These are some of the questions that the Chamber of Commerce has put to the Department of Labor for an employee who maybe has fluctuating hours and they're working at an hourly basis. How are we going to calculate that regular hourly rate? Is it going to be an average of prior weeks worked or something like that? It's going to be easier for certainly for salaried employees and even hourly employees that put in a normal 40-hour work week. But for employees who have sort of a fluctuating schedule, we're certainly going to be looking to the Department of Labor to provide some guidance. But the rule is 2/3 for childcare.
The next question asks, are physicians exempt employees? Can salaried employed physicians have their salaries reduced even though there is an employment agreement?
Well, the last two words in that question is the real haymaker. The short answer is physicians are exempt. Physicians can have their salaries reduced, but you got to pull out those employment agreements and see what they say. And David can talk a little bit about that.
No, that was my comment, is that I would agree that, fortunately or unfortunately, physician providers generally are covered by employment agreements in most practices. And that is going to dictate what you can and can't do in many instances with respect to their compensation. So if that is an issue that you're facing, you should be pulling out those agreements quickly and taking a look at them and looking at what the termination provisions are in particular.
If an exempt employee is in the 10-week leave of caring for a child under EFMLEA, can they do any work during that period?
Sure. One of the things that, again, I keep saying that there's a lot more we don't know than we do know, and hopefully we'll know a lot more shortly. But under the FMLA, normally, employees can take leave in partial day increments. So an employee can take FMLA leave in 1 hour increments or 2 hour increments or in a half day increment. So is that going to be the same thing for this Emergency Family Medical Leave Expansion Act? If someone needs to care for their child for 2 or 3 hours a day because they have someone else that's able to fill in and help for the other parts of a day, can they take partial day increments of leave under this new expanded an emergency family medical leave? We don't know. I think that the answer to that is probably going to be yes. So if I want to take 4 hours of leave in the morning to care for my child who is home because school's closed, but I have a mother or a father or a spouse or someone else that's going to come in the afternoon and take over, and I can get to work, or I can get to my home office to telework, I think that's probably going to be the way it works out.
All right, the next question asks what hazard pay is, and if practices are required to pay employees a higher hourly wage if their current job responsibilities include testing patients for COVID-19.
I have not come across hazard pay in this type of scenario. Jim, have you seen that?
No, I haven't seen that. We can get back on that question, Chris, so we can maybe provide you with the response that you can forward. I'm not familiar with a hazard pay in the normal healthcare provider practice area.
And certainly none of the guidance that we've seen so far through legislation has referenced an issue of having to pay people a higher rate.
Yeah, hazard pay tends to be, I believe, for the most part, sort of at least in the private sector employers, it's going to be sort of a policy issue. It's most of the time we see it if in the government contracting space, if a contractor is going to be sent to a region of the world that is particularly dangerous, they may get some hazardous duty pay. But that's a sort of a self-inflicted policy that employers use. I'm not familiar with it as a federal or state or local law.
This question asks if the corporate office of a healthcare entity is considered essential.
So we haven't seen any delineation between the different functions within a medical practice or a healthcare office, for example. So the guidance that we've seen from the Office of the Legal Counsel for the Governor simply said that healthcare practices are deemed essential. I think there is an expectation that the practice needs to continue to operate. So I don't believe that there's guidance saying that those are non-essential. I think it's just deemed to be part of the practice.
This question asks, to be clear, if a salaried employee is used one day during the work week, do they have to be paid for the entire week?
Yeah, if an exempt employee is used one day during the week, they have to be paid for the entire week. As I said, if there's PTO available that can be used to offset the remaining days. So, for example, the employee works Monday, and they're not working Tuesday, Wednesday, Thursday, and there is 32 hours of PTO available to apply to the employee's pay so that the employee receives a full salary for that week, then that is compliant with the FLSA. But if it's an exempt employee and that employee only works on Monday and there's no wage replacement PTO available, the employer is still obligated to pay that employee for the entire week.
Okay, the next question is, if COVID-19 continues to go on as is projected, and a business cannot have the cash flow to continue with 90% of their staff beyond April 2nd, if they decide to do a mass layoff on that date, is the employer still responsible for paying them beyond that?
Again, this is one of the questions that the Chamber has put to the Department of Labor. What happens if a business ceases operations or does a mass layoff, just prior to or on the cusp of this particular April 2nd deadline, or if it's done before an employee requests the leave. So, for example, if The layoff is on April 4th, and between April 2nd and April 4th, no employees have come forward to request paid sick leave or expanded family medical leave. We don't right now know the answer to how the Department of Labor is going to interpret that.
Okay, and I have what I believe is our last question of the evening, unless someone wants to come off mute by pressing *6 and ask one. And that is, can you summarize what a best practice would be for a private practice with 3 employees that has totally closed down their practice for the time being? Would continuing to pay employees at 2/3 salary be considered a best practice?
I don't know if there is. I don't know if there is a best practice for that. This is, really a matter of economic feasibility, it sounds. Jim, I'm not sure if you've encountered that. We certainly have small provider groups. Mostly what they're doing is looking at whether they're going to furlough or lay off employees. It's really a matter of what the practice is able to do. So
I've seen, I've over the last probably 4 or 5 days, I'm starting to see a change in approach. I would say that last week, and certainly at the end of the prior week, most employers, from medical healthcare providers, sort of across industries, were taking the view that they were going to try to keep their employees employed and to ride it out. And whether it was to pay them at full pay or to pay them at 2/3 rate or whatever, that was the thinking last week. This week, things are starting to change. We're seeing more and more businesses, including healthcare providers, doing partial or full layoffs, going to furlough situations, starting to tell employees that they're going to have to use their PTO in order to bridge the gap here. So my view is, as employers are looking down the chute here and seeing that the situation is probably not going to resolve soon, and is certainly more dire than most of us had hoped over the last week or two. And as the number of infections continue to rise, and we have not yet seen a flattening of the curve, and more states are ordering businesses to shut down, it seems to me that we're on the front end of this curve and not the back end of it. So I think more and more businesses are taking a dimmer view and having to make tougher decisions. So putting a staff on 2/3 pay, that's very generous for right now.
Okay, and then as a
Particularly for a
follow-up,
smaller.
to the layoff question, what does it mean to show that the practice has to apply for exemption for all extended payouts if they have less than 25 employees?
So we don't know exactly what. Go ahead.
Go ahead, David.
So we don't know exactly what that's going to look like yet, because even though the concept of being able to apply for an exemption is included in the federal legislation that came out, they did not provide guidelines on how that is to be done. That is supposed to be being determined through, I believe, the Secretary of Labor. So we are expecting to see some additional guidance on that. But generally, the threshold that has been passed around will be whether or not it is feasible for this business to continue to pay under the federal benefits that have been provided and still be able to continue as a going concern.
Right, and that's going to be for employers with 50 or fewer employees,
Right.
not 25.
That's right.
The 25 employer threshold is under the expanded family medical leave and the reinstatement requirements. That's going to maybe provide relief for employers with 25 or fewer employees. Whether or not the viability of a business is threatened by having to pay this federally mandated leave, that's going to be something available to employers with 50 or fewer employees.
Okay, we have another request for clarification. If an exempt employee has exhausted their allotted PTO, then the practice would still need to pay them for 4 days of a week if they call out.
I'm not sure I understand the question.
I think it goes back to if an exempt employee has worked 1 day during a week, that you have to pay them for all 5 days.
Could I
Correct.
just interject or clarify my question?
Yeah, go ahead.
Yeah.
Because it sounded like if we didn't have a PTO policy for the exempt employee, and this is the first I'm hearing about exempt employees needing to be paid for the whole week if they have exhausted their PTO. We usually, if they worked half a day, then we would pay them the full 8 hours for that day.
Correct.
So if they had 120 hours that they were allotted for 2020 and they've already used all 120 hours, and now due to the COVID they're for any reason out for 4 out of the 5 days they typically work the week, and they worked 1 day in that week, we would have to pay them the whole week?
Correct. If they're an exempt employee, they have to be paid. They have to be paid that salary regardless of the quality or quantity, and that goes to that last piece, the quantity of work.
And Jim, does this comes up in particular where there is a reduction in hours or a furlough? This is not necessarily under the expanded federal benefits. I think that's
No, this is a standard Fair Labor Standards Act
right. I think that
issue for exempt employees. Yeah.
Okay, so
I see another question. If the exempt employee agrees to reduced pay, let's say 20% cut, is that okay to do? Yes.
all right, so we're going to go ahead and wrap this webinar up since we are 30 minutes over. I want to thank you all so much for joining us, and I also really want to say thank you to Jim and David from Paley Rothman. They bring incredible expertise and knowledge to us, and we really appreciate them taking this time with us this evening. We will make this webinar available online on our YouTube channel. I see from some of the folks in our chat that the video isn't all the way up yet, so bear with us. It'll be up by tomorrow morning at the very latest. We also already have our telemedicine webinar up on the YouTube channel, so if that's useful to you, we hope that you'll visit us online there. There are a few other things that I would like to let you know about if you're not already aware. The first is that MedChi has worked with the Maryland Department of Health to get an all providers or an all clinician conference call with Howard Haft from the Maryland Department of Health every single week on Monday at 5 p.m. So there was one earlier this evening, but that will be recurring going forward. So if that is of interest to you, please visit medchi at medchi.org/coronavirus and go ahead and RSVP for those. Our next webinar in this series will be held tomorrow on Tuesday, March 24th, and it will address the rapid implementation of remote patient monitoring. And then I also want to encourage everyone on this call to participate in our new Facebook group for physicians. It is a completely private group, and you do have to be a licensed physician in Maryland in order to be added. It's just an open space where local physicians can talk with one another in a private space about what they're experiencing in their practices. So we encourage you to participate that way with us. And all of this information will be in a post-event email along with the slide deck and the link to the webinar. So thank you all very much for participating this evening. And I will sign off and let you all enjoy the rest of your evening. Thank you all very much.
Thanks, everyone.
Thank you, everyone.